masks, when we wear masks, we're actually protecting the other person. So this is really a situation where how good of a fellow citizen are you? Because when you wear a mask, you actually protect the other person. It's interesting. If you're wearing a respirator, of course, you're protecting yourself and the other person. But number one, the mask is preventing your droplets from being highly infective. And so you're protecting the other person. I think that's a really important point to make. This is one of those situations where the measures you do are helping others.
Yeah, and it's something that it's actually quite easy to do. It's mildly annoying sometimes, but if we're talking about this kind of impact, it's really quite easy to do. So how has your military experience affected the way you approach engaging with this pandemic? And you've been on the front lines here as an ICU physician.
Yeah, no, thank you. Yes, so I served in Iraq, I served in Afghanistan. So it is the same, and it's a bit different. It's a bit different in the sense that it's a virus now rather than gross trauma. But it's the same in the sense that the danger for a provider is the same as the danger for a patient, right? What I find that's remarkable about this is a lot of my colleagues who are civilians, they're now seeing what it's like to work in truly a wartime environment. Many, many patients, they're all coming in. The system is getting close to being overwhelmed. As you know, New York City came very, very close to running out of ICU beds. These are facts that happen during crises, and wartime is a crisis. And of course, there's the danger to the provider, right? But at the same time, it's always focused on the patient, right? The patient first, the patient first, the patient first. And what you do is what's wonderful is you see a lot of these folks that are the nurses, the respiratory therapists, even the housekeepers in a hospital. They're all unsung heroes, and they go to work and they do the job in spite of the tremendous danger to themselves. It's very much like a wartime environment. It's a wonderful thing. I mean, people do care about other people, but it's gratifying. It gives you hope on mankind.
Yeah, it really does. And it also, people show their true colors through these kinds of situations as well. So let's shift to the soda machine that you told us about at Twin Global 2018. To remind people who are with us, or if you have not seen Geoffrey Ling's video from Twin Global 2018, after Twin Tech 2020 is over, go to that video, watch the video, bring your kids into the living room, skip the Netflix for just 20 minutes. Geoffrey shared this idea that he had to produce pharmaceuticals on demand wherever and whenever needed. And the darn thing works. I mean, it's a mind-blowingly simple solution to an excruciatingly big challenge. So, Geoffrey, tell us a little bit about on-demand pharmaceuticals and what you guys are up to, how that's developed in the past 2 years.
Well, in fact, Rob, it's accelerated dramatically in the last 6 months, largely because of some of the vulnerabilities that have been shown because of this pandemic. So, to bring us back, when I was in Afghanistan way back when, I ran out of a drug. It was a drug called bromocriptine. And I needed it for a young wounded soldier because he had suffered a pretty severe injury. And I needed to stabilize his blood pressure and his heart rate so that he could get on an airplane and be airlifted to Germany for definitive care. So, as you would imagine, in the entire country of Afghanistan, I could not find any bromocriptine. I mean, there just isn't any. This is an old generic drug. We didn't have it. I needed it to stabilize this young soldier, so the Air Force flew it to me. And when the Air Force flew it to me, I often thought to my head, oh, my goodness gracious, this box of bromocriptine probably cost like $300 gazillion just in jet fuel alone. But needless to say, I had it. I gave it to the young soldier and sent him out. But it gave me an idea. And that idea if you think about it, bromocriptine is an old drug. My Ph.D. is in medicinal chemistry. And if I had a chemistry set, I could sort of make it myself. And so that born the idea of an automatic chemistry set. And when you step back again and you say, bromocriptine, how unusual of a drug is it from a composition of status? It's not that unusual. It's an organic compound. It's made of carbon, hydrogen, and oxygen. Ibuprofen, same thing. So what it means is, if I had a good chemistry set, a really good chemistry set, and I had a pencil, I had a glass of water, and an egg, I could make anything, right? Because they all have carbon, hydrogen, and oxygen in it. So We're not quite at a pencil, a glass of water, and an egg, but the concept you understand is that you can start with very few starting materials, so you can make a whole bunch of stuff if you had a really, really good chemistry set. So the problem distills down to just two things: chemistry and an automatic chemistry set.